We'll be getting started shortly. Please share your name and where you are joining from with us in the chat box. Welcome, everyone. Thank you for joining today's webinar, Clearing the Air, Steps to Going Smoke-Free. My name is Abby Nellis, and I am an associate with CACA's Geographic Health Equity Alliance, or GEA for short. GEA, in partnership with American Non-Smokers' Rights Foundation, is excited to present today's webinar, which is the second webinar in our two-part Clearing the Air series. Just a little background on GEA before we begin. GEA is a CDC-funded national network dedicated to reducing geographic health disparities related to commercial tobacco and cancer. Using a community-led approach, GEA specializes in helping state tobacco and cancer programs and their partners, such as state coalitions, local public health departments, and local coalitions, build capacity to implement effective public health practices that positively impact community health. We encourage you to visit our website, geohealthequity.org, to learn more and subscribe to our monthly newsletter. I'm sure we are all familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please use the Q&A box. This week, you'll receive a post-webinar email with the recording of the webinar, slides, and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. And now I'd like to introduce our presenter. Today's webinar will be led by our valued partner, Anjul Smith from American Non-Smokers' Rights Foundation. Anjul Smith has worked in the nonprofit sector for more than 20 years, helping organizations and communities build their capacity for sustainable change. She has conducted sessions on grassroots advocacy, coalition building, strategic planning, and fundraising. Ms. Smith served as the Deputy Director of the National African American Tobacco Prevention Network. She worked closely with communities throughout the country to reduce tobacco industry presence in African American communities. Ms. Smith also worked closely with local and statewide tobacco control networks, providing technical assistance to their efforts to reach out and involve African American and other communities of color. Ms. Smith was also a consultant to the Robert Wood Johnson Foundation Tobacco Policy Change Program in the Galvanizing Communities to End Childhood Obesity Initiative, in which she provided technical assistance to grantees in the areas of community organizing, grassroots advocacy, and social justice issues. She currently serves as the Southern State Strategist for the American Non-Smokers' Rights Foundation. Ms. Smith possesses a Bachelor of Arts in Communication from the University of Colorado and a master's degree in Human Resources Development from Webster University in St. Louis. Anjul, I will pass it on to you.
Wow, thank you. Well, that was interesting. So I appreciate that. And I was looking through the chat and I saw some familiar names. So it's really good to see some folks that I know have been in this fight and working on this issue, among others, for years. And I'm really excited that there's so many folks here that I don't know and I'm not familiar with. And I know my colleague Tracy would agree that we welcome any opportunity to work with you guys on whatever tobacco control, especially smoke-free work that you're doing in your communities. And so I'm going to share my screen and jump right in. And today, going to focus on the basics for going smoke-free. in your community. And again, welcome any questions, you guys, that you guys will add to the chat, and we'll try to save some time at the end to talk about this and address any of your questions or sharing for later. So I don't know about you guys, but on any given day, this is me. This is me at my desk, probably literally on any given day. But the hardest thing about starting a smoke-free campaign is really figuring out where to start. And we want to get everything right. We want to make sure that we're planning the best campaign. And sometimes that process itself can be a bit overwhelming. So A&R, we've got a ton of resources. A&R and the A&R Foundation, we've been doing this work for almost 50 years. And while we don't have every answer, we've pulled together tools and resources that we are excited to share with anyone. These are available on our website. If you have any question about where to get started, deal breakers, information on going smoke-free in your community, model policy language, we do have these resources available and for download on our website, and you can find them here at this address. And so we'll take a look at some of that and discuss some of these during today's session. So let's start with sort of a big picture view of the steps to success for local policy change. And it's a process. And kind of that overwhelming process can be broken down into some bite-sized chunks. And every policy campaign needs to start with an assessment and really taking a good look at what those current policies are in your community. And of course, you guys know and probably already have a coalition to start working with. And the strength of your campaign and the strength of what you can do in your community really flows through having a good coalition. Of course, establishing a database of supporters. The power of your advocacy campaign will come through the people that you're able to bring into the fold, to sign up as part of your coalition, and that you're able to access when it's time to advocate for change. And we'll talk about what some of those things look like. Educating your community, we'll dig into this just a little bit through this process and conversation today. The heart and soul of a smoke-free campaign is making sure your community understands this issue. Being able to know what your community support looks like, drafting your policy and getting good language on the books, finding a good sponsor, and we'd go as far as to call them a champion and someone that on the decision-making board that will really carry this forward for you and really help you get a good, strong policy passed. Showing your power, bringing all of these pieces together and demonstrating that the community is behind this and pushing those decision makers to move, to change policy and to respond to community will. And of course, implementation. You can go through all of this, pass a good policy, but it's really important that you're able to make this policy change stick. And while all of these steps are important and they're all laid out in our Going Smoke-Free in Your Community document that you can find on our website, we're going to spotlight just a few of those pieces today. So we're really going to take a little deeper dive into assessing the current situation, educating on this issue, and advocating for policy change. So probably more important than anything, and especially as you're getting started, assessing the situation is really important. And in the true nature of A&R, we've got a document, a tool for that. It's called our Getting Started Ordinance Development Planning Form. And it's sort of this multi-page assessment document that'll help you ask some really important questions about your policy status, your coalition, decision makers, the opposition, all of that, right? And I'm gonna be honest with you guys, it's probably at least 11 pages long. And I used to be the most cynical about this document because I was like, it's too long. Nobody has time for all of this. This stuff, we don't need to really put this down on paper. But over the years, I'm the biggest advocate for this process. So while it looks tedious, the information you get from going through this document with at least your core coalition partners will really be helpful as you start to plan your campaign and start to really strategize what's needed for a successful smoke-free campaign. It'll ask questions like, what's the current policy in your community? What's the process for changing it? And how will this impact your community? It takes you through a few of these steps, as I mentioned, and these are just really important and some things that I think if you jump right into a smoke-free campaign, you might miss these pieces, or you won't think about really diving into really getting the robust information you need for each of these sections if you don't take a look at this before you get started. So we really suggest going through this process and really taking a good inventory and assessment. A couple of the questions through this process and what every campaign should start with is figuring out what your current policy status is. And you'd be surprised how many times we dive into a campaign and start to want to talk about changing something, and we really don't know what's on the books. Because that'll be the first question that anybody's going to ask you. Like, well, what does the current policy do? And so this assessment piece will ask you to figure that out. And you can find that out by finding the local ordinance, or if you're under a county or statewide law, actually looking at the language and seeing what it applies to. Does it cover cigars and hookahs, e-cigarettes? Does it cover hotels and motels and gaming venues and all of these different places? Because you won't know what you need to change with the new law unless you know what's currently in the existing law. What are the exemptions to the law? Are bars exempted? Are private clubs exempted? Some folks are surprised to find out that you can still smoke in hotels and motels and that some rooms can still allow it. You'd be surprised that some of your policies still allow for break rooms and workplaces to allow smoking if there's not any spaces where the public's allowed to enter. And while that and some of these other exemptions may have been okay years ago, well, they were never okay, but they may have been more accepted. The status quo has changed and expectations are changed. And it's more common to make all of these places smoke-free to protect the public, but then also to protect the workers in these spaces. And so knowing what these policies cover and what they don't cover is really important. Another key piece to this is what agency enforces the law. And if you're going for a local ordinance, if it's city council, a county ordinance where it's the board of commissioners, if the local health board of health can pass this type of policy, who's responsible for passing it and enforcing it? If it's law enforcement, the fire department, the health department, knowing these things will really help you in the process. Additional questions that you will want to answer, and I've added these because time and time again, we get started on campaigns and someone will always ask the question that we haven't yet answered. And someone will want to know, well, which businesses will be impacted by this law? And they want to know, like, not just categories like this, like whether it's local restaurants, bars, bowling alleys, hotel, motels, because usually those are the ones that are currently exempted. But they want to know, like, is it Joe's Rib Shack? Is it the, B&B bowling alley down the street? Like, they want to know. And it helps if you're familiar enough with the local community and what the policy, the smoke-free status is, what that looks like on the ground. It's just really helpful to be familiar. And again, who has the power to pass this? Knowing that, and then the process for it. Do you need a sponsor? How many readings and how many votes does it need to pass? Will be really important as you plan for your strategies in getting this done. And again, we're finding more and more how important it is to know if there are any preemptive laws on the books and whether or not your coalition or your local government has the authority to pass any type of policy, particular tobacco control policy and smoke-free laws. Are you preempted by state law that says you can't do this? Or is there any particular provision that you can't pass? For instance, Tennessee has a statewide preemption, and they recently rolled it. They rolled it back to allow for local communities to pass smoke-free ordinances. However, they still can't address things like cigar bars because the state still preempts local governments from addressing cigar bars. So they got some of their local power back, but then there's certain things they still can't address. But that's good for them to know, because as they're working at the local level, they know that they have the power to pass stronger laws, but they also know what they can and cannot address that's out of their control right now. And so knowing these things really help you to be very strategic about the plans that you put in place and the policies that you're working to achieve. So how does the community feel about smoke-free environments? And one of the pieces that's really important as you will be on this journey will being able to communicate how the community feels about this, and that there's strong support. And when resources were abundantly available back in the day, we would do these really elaborate polls and hire an agency to do some polling. We'd get some great information. I don't know if those resources are available the way they used to be. So polls are great if you can get them done. Man, you can leverage that information in all these different kinds of ways to share where people are being exposed and how they feel about it and what they're comfortable with in terms of changing those policies. But I'll be honest with you, man, just a simple survey sometimes is just as good. And your goal is to tease out information from your community, and being able to communicate to stakeholders and decision makers that the community wants to see this happen. And these are some examples of questions that have been asked in surveys and how coalitions have taken that information and made it, usable and shareable in different ways. So this is always a great, and I think this is an example from Fayette County in Georgia, and they developed a survey, and I think they partnered with their local school board to distribute this out to the database there of parents, and they got great response. And they were able to get this information and able to communicate it as representative of their community, and to really talk about how this was important for the community. So educating on the issue is one of the most important pieces of a smoke-free campaign. Your community needs to understand why a change is needed before they can ever really advocate for change. Unfortunately, status quo sometimes rests well with a lot of folks, and they don't know that something needs to change until they understand why. So, engaging in a good outreach and education campaign really helps to lay the foundation for change and helping people understand that status quo is no longer acceptable. Just because something's been that way doesn't mean it needs to continue to be that way. And so, our favorite line is educate, educate, educate. And we recommend doing that. The education campaign doesn't have to be boring and drab, and it can be an exciting campaign that really works to message this issue in a number of different ways that will resonate with the community. I know it's hard to talk about smoke-free environments. I know it's not the issue that's on top of everybody's radar. There's a lot of things happening in our communities, and exposure to secondhand smoke might not resonate with everybody. But that doesn't mean we don't talk about it. That doesn't mean we don't advocate for change. And that doesn't mean we don't push the envelope and work really hard to make sure that this is one of the priorities in a community that's talking about health equity, that's talking about healthy environments, that's talking about how important frontline workers are, that's really talking about hospitality and, being of service to the community. You can't talk about this stuff and have the public and or your workers exposed to toxic environments. And you know that you're putting them in this for whatever your rationalization is. But there's a number of ways to talk about this. And it's really important to tease whatever information you have with your partners in public health, in the health department, and the folks that get that good data. How do we translate these messages in ways that resonate with our community partners, the general public, stakeholders, and decision makers? And don't be afraid to translate these messages. We want it to be broad enough that it resonates with the community, right? But we also need it to be specific enough that we're touching on the people or the issues that really matter in the community. And if you need to tease out and develop communication pieces that talk about how this impacts African Americans in the community, or how this impacts women and pregnant moms who may be working in some of these spaces because there's secondhand smoke and it's hazardous for the mom and the baby. If we need to talk about this as a social justice issue, don't be afraid to also tease out some of these message points in ways that will resonate throughout the community. And I'll say this is hard. This is not comfortable for we're still in places where we're not sure how to take on tough issues, but we have to talk about it. We have to talk about cigar smoke is hazardous to public health. We have to talk about hookahs being hazardous to public health. We have to talk about e-cigarettes and vapes still as hazardous to public health. We have to get comfortable talking about some of these tough things, because if we're not prepared to address what we do know about these things, we'll have environments that will still allow them because the community's not prepared to take a position. And we've got examples from other coalitions and campaigns that may be helpful, but we know that you guys have access to some of this as well. But please, please, please don't be afraid to take on tough issues. Our communities need us to be upfront and forward about these spaces. And we know that sometimes communities don't give a crap about public health. They just don't. And sometimes we really just have to talk about smoke-free is good for business. And it is. And we can still talk about that in ways that resonate on a number of different platforms and with a number of different audiences. And these are some examples from different campaigns that talk about smoke-free being a benefit to businesses and bars, and the economic impact of going smoke-free, and how communities across the country are continue to pass smoke-free policies. I'm gonna tell you, if smoke-free environments weren't good for business, you would not still see communities passing strong smoke-free policies in ways that protect all the public and all workers in all of these spaces. This is good for public health and it's good for business. And with all of that as part of your education and advocacy campaign, we recommend being everywhere you can be. And these are just some examples of things that happen in the community where your coalition could have a presence. It's more convenient when people can come to us, but it's more effective when we can go to them. And there's so many opportunities if you're just having 5 minutes on somebody's agenda, or you're able to set up a table and maybe give out some freebies, or just have touch points, opportunities to connect with the community, to really talk about this issue, and to listen, can go a long way with helping your smoke-free campaign. And when you do this, ideally, you want to also get something from the people you're having touch points with. And we have some great examples and experiences with gathering information. If you could get contact information, add them to your database as we talked about, or get folks to share their story. Like, what's your experience with smoke-filled environments? Have you ever worked, or do you know someone who worked in an environment that allowed smoking? You'll be surprised that people are willing to talk about this. And if the more information you can get from them, the stronger your campaign will be when it's time to really put some of this in action and get to the advocacy part of your campaign. So now that your community believes there's a problem, they're ready to do something about it. And so we're going to transition from just educating and making sure they understand the dangers of secondhand smoke exposure and the benefits of smoke-free environments into, we're no longer satisfied with status quo, and we're ready to do something about it. So the keys to a successful advocacy campaign include a few things. Our campaigns are at their best when we can lift up the voices of the people who are most impacted by this. And if those are workers, like a bar worker or a casino worker, or depending on where this secondhand smoke exposure is happening in your community, or just folks who have a story to tell about these experiences. But that's not always available to us. So collecting those stories is great. Being able to tell those stories is even better. If they can tell it themselves, wonderful, but we've got to tell that story if we can't get them to say it for themselves. And we can do that sometimes by also building partnerships. So they're not always readily accessible to us, but sometimes we've got to build partnerships with the organizations that do have access to hospitality workers, to hotel and other workers, to bar owners in the business community, or to folks who just have had a personal experience with a smoking-related illness. And building our networks and strengthening our base really helps to come through these partnerships. Throughout this campaign, staying on message will be so important. I can't tell you how easy it is to get off message, because folks will ask every question about everything you're not talking about, and they'll want you to answer it. But it's so important to get back to your message. And there are great examples of how you can do this. And of course, expect the unexpected. Prepare your coalition and your council supporters on what to expect in terms of opposition arguments. Like, here's what you'll hear. And you don't want to be surprised when folks pull out these insane arguments against smoke-free environments and protecting public health, but they will come. And it's great to be prepared and to be prepared to respond to anything quickly. And so thinking about message development, we've got to consider, what do they need to hear? Those are the messages. Who do they need to hear it from? Those are the messengers of your campaign. And how do we get them to hear it? What's the delivery method that will be used in this campaign? Like, how do we get them to hear our message? And there's so many different options for that. We've got this worksheet, and I don't think this is on our website. And if you guys are interested in this, or you can screenshot and create it yourself, right? But it's a messaging worksheet to help you think through those couple of things. Who needs to hear your message? Who's your target audience, person or group? What information do they need to hear? And sometimes that's a strict public health message, like, this is secondhand smoke is bad for health and triggers asthma and leads to X, Y, and Z. And sometimes it's just an economic impact message, like smoke-free environments are good for business. Like, people need to hear different things, and you need to think through which of your targets need to hear which message. And who do they need to hear it from? Like, put it down. Like, is it a bar worker who needs to deliver this message? Is it a member of the public health community? Is it a medical professional who needs to deliver this message to that person? And how are we going to get that? Is that a letter? Is that an ad? Is that social media? Is that a phone call? But thinking through these things will help you build a solid campaign that has purpose and intention. And here's an example of that spreadsheet kind of worked out. So let's say you're trying to reach the mayor, and your mayor may be one of those that's just not interested in public health. We've had those that just wanted to know, is this good for business? I don't want this to hurt our business community in our city. Well, yes, this is good for business. And who did that person need to hear it from? They wanted to hear from the chamber. They wanted to hear from the tourism industry that these stakeholders were going to be good with smoke-free workplaces and bars and hotels and different things. And how did we need to get that to that decision maker? And again, these are things that you need to plan out and think through so that you can put together a good plan. And all of that, like, when it's time to advocate with all of your messages for this policy change, you want them to come through all of these voices. And, assuming that this and more is represented in your community, you want those voices speaking about this issue. They need to hear from them. And this may look different in every community, but your core coalition will always be there. And these other allies may not attend every meeting. They may not attend every event that you have. They may not get involved throughout the whole campaign, but they need to be represented in some way. They need to have an opportunity to support. So I'm going to play a quick video as an example of how some of these messages are delivered through the campaign.
My mom.
My dad.
My aunt works
In a smoke-filled place.
And even though my dad doesn't smoke,
Mom doesn't smoke cigarettes.
they breathe in secondhand smoke.
It makes her sick sometimes.
It's killing my dad.
It's not right.
And they shouldn't have to.
They don't choose to breathe the smoke.
They have to.
To cover the rent.
To put food on the table.
To pay my health insurance.
I want clean indoor air.
Clean air no matter where you work.
For my mom.
For my parents.
Learn more.
Get involved.
So this was an example
My mom.
from, that was an example from using youth voices. And even in campaigns where all the youth spaces are already covered, these young folks were speaking to the fact that their parents are still working in these spaces where they're exposed to secondhand smoke, and that they're advocating for smoke-free environments for the folks who are out there working hard to pay the bills and provide. This is a quick example of, we've got an incredible campaign of casino workers out of New Jersey and in several other states, Pennsylvania and others, where they have been very vocal about how secondhand smoke is impacting them. And I'll let you listen to one of our casino workers.
Working in a smoke-filled environment sometimes is torture. One cigarette is almost unbearable, but sometimes when you get 3 or 4 people smoking, say it should be illegal, but it should be illegal. The cigars are the worst. They make your stomach sick, your throat is burning, your eyes are tearing, and it's just allowed. It's torture working under those conditions. It really is.
So that was just a quick snippet. We've got a number of different videos from workers who are just fed up and tired of working in these conditions. And it's great when we can get those voices to speak for themselves. But again, that's not always the case. And there are a number of examples of campaigns over the years and from different places across the country that's still delivering that message. This is one from Louisiana several years ago that really highlighted their what they call their cultural economy industry. And it's their musicians, their entertainers, their casino workers. That's the heart and soul of what happens throughout Louisiana. And they're exempted from the smoke-free law. And they're arguing and making the case that they deserve to breathe smoke-free air at work, just like everybody else throughout the state. More examples of highlighting this for workers and talking about how these exemptions are unfair to folks who are working in these industries. Musicians have told their story and shared, and when we can't get them we have other ways of telling their story, and just sharing their quotes and their pictures and sharing it on social media helps to get the message out and to show that it's more than just public health working for this, that there's an army of advocates and people who really care about this issue. Our Atlanta campaign years ago partnered with the LGBT Health Initiative, a statewide advocacy group that had very creative ways of getting this message out to their constituent base. And again, our core coalition may not directly have all of these great contacts with community stakeholders, but we have partnerships and alliances with groups that do. And we have to sometimes allow them to do what's best for reaching their constituents. And this was a great partnership and allowed us to really reach into Atlanta communities and broaden our network of advocates. And at the end of the day, we all have to breathe smoke-free air, and that's the message that resonates throughout all of these efforts. And our goal is to get this out in any way possible. And it doesn't have to include all of this, but you can consider it all and figure out what works best for your community. There's so many different platforms out there and opportunities to get the message out. Our goal is to just make sure that we're not talking amongst ourselves. If we're only talking to each other, our coalition and our core partners, we're not getting this message to the broader community, and that's who matters in these types of campaigns. And of course, reaching out to local officials, the people who have the power to make the decisions, is really, really important. And they're the ones that can pass this or not. And so this is not one of our resources. This is from one of our partners, Tobacco Free Kids. And it's a worksheet for doing a political assessment, part of the Doing Your Homework series, right? But it really lays out who the decision makers are and who their influencers are, so that you can start to think through the layers of targets and outreach that your coalition needs to go through. I highly recommend. I think this is a great tool for honing in on the political assessment. Also part of this tool piece from Tobacco Free Kids is figuring out what their positions are, and it'll help you kind of think through getting an idea. If you don't know exactly, sometimes we can make some assumptions until we know better, but it helps us to strategize and prioritize who to target and how. And then I think lastly, on the big checklist of things to consider as part of your campaigns is to anticipate the opposition. We have to think about and be mindful of who our opposition groups will be. Like, we know it'll be bars, right? Smokers. We can think about now these emerging issues around hookah and cigars, and the vape, it used to be vape shops. But we know who our opposition will be. But what we should also do is strategize around them like anything else. We can't just assume and know that they'll be there and not plan for how to deal with them. And this, again, from TFK, is a tool for understanding your opposition, who the opponents are, what their arguments will be, and who do they influence, because we kind of need to know that, and it helps us understand. These are some of the things you can expect to hear from opposition: that workers can find another job. This is about business owners' rights. Don't tell them what to do, and you're trampling on my freedoms, and smoking's legal. How can you tell me I can't do it? And workers should pull themselves up from the bootstraps and get a better job, and that this will be a financial hardship on business owners. It doesn't matter what community you're working on, the arguments from the opposition are the same. So there should be no surprises. We should be able to anticipate it and find examples of how to address it, even from our partners in other states, but we at least know what to expect. And then we should really plan to respond. And these are some examples of how we've prepped communities and decision makers on responding to opposition, especially when you know you've got folks on your side, right? It's okay to tell them, hey, this is what you can expect to hear. And here's how we address this. This is what we have to say about that. And we've done that in many communities just to help, because as you know, sometimes when the bad information gets out there, we've got to undo that. And so it would behoove us to get our message to partners and even some decision makers before that happens. A powerful and successful campaign is about educating your base. It's about providing opportunities to speak up and speak out. It's about giving them opportunities to take action. And if that's signing a postcard or making a phone call or writing a statement, attending a meeting, all those things that really demonstrate your power. And knowing who can give us what we want, and are they feeling the heat? Do they know how much the community wants this? We don't want pent up energy. We want to release that energy and make sure that they understand that this is important. And lastly, this is my checklist for before you move any effort to introduction and say, hey, we're ready for a vote. You're not ready for a vote on an ordinance if you can't check these things off the list. Have you done your homework? Do you know what the policy is, what's covered, what's not, and how the process? Can you speak to what this looks like in your community? Do you have community support? Can you turn around and say, my community wants this, and here's a demonstration of that support? Do you have stakeholder support? If that's the business community, if that's the public health community, if that's hospitals and the chamber, and who are the key stakeholders And do you have support from the ones that matter to your decision makers? Can you counter opposition arguments? If you can't respond to the heat that the opposition is going to bring, you need to prepare, because you will have to make that case before council when it's time for this to be brought up. When you've got to testify, they're bringing their folks too. And you got to be able to counter these arguments throughout the campaign and the day of decision making. And lastly, if you don't have the votes, if you know you need 4 out of 7 or 7 out of 9, whatever it is, and if you need the mayor to be a tiebreaker, that's what happens. If you don't have decision maker support, if you don't have the votes to win, do not put it in ordinance up for a decision. You've got more work to do, and it's okay. It's okay to keep working until you're ready. It's important that you move forward a strong policy and that you give it an opportunity to win and do what it needs to do for your community. So that said, again, just a reminder, smoke-free air is good for health and good for business. And just a reminder about our website address with a number of different tools and resources that will help you throughout this process. So I will kick this back over to Abigail, and hopefully there's some questions for us.
Yes, we do have one so far, and if anybody else has any questions, please drop them in the Q&A box. But thank you so much for that, Jewel. I learn something every time I talk to you or hear you present. So the question we have in the Q&A is, how do you square the campaigns which say that these policies are good for business, presumably targeted at bars, and refer directly to drinking, given that many of these people are also trying not to promote alcohol use?
I actually thought that question was going somewhere else. I thought the question was going to say that smokers usually linger at a bar longer and drink longer, right? So let me make sure I understand. We're not, our focus is reducing exposure to secondhand smoke. And it doesn't matter the environment and how we feel about it, right? And it's not, we're about protecting the public and protecting workers. And so we believe that smoke-free environments should apply to all places at all times and should cover all products. And so that is separate and apart from any other issue. And so I apologize if I'm not answering your question. It's not about promoting the bars and that industry, but we're just protecting the health of the people and the workers in these spaces, regardless of the rest of that, if that makes sense.
Thank you, Jewel. And then I had just a couple questions. One is, as you know, we at GEO work with state departments of health and local health departments trying to pass smoke-free policies. And one thing we always recommend is finding a program champion. And so do you have any advice for what people should be looking for in a program champion and best practices for finding and recruiting a program champion to help move their work forward?
When you say program champion, so this is not like a decision maker champion, or you mean more of a?
Yeah. So someone in the community that can help local health department, state department of health pass these smoke-free policies and kind of lead the work and champion it.
Yeah, we've seen that happen in different ways. And so, sometimes it's one of the partner organizations, like some of our public health partners, that takes the lead on organizing the coalition and kind of helping to strategize and lead the way. And that, sometimes might be like the local advocacy partner from American Cancer Society or from American Heart Association. We've found some great partnerships with other partners from the community, whether they're public health, drug prevention partners. I find that the organizations that are just rooted in the community and really care about an array of issues impacting the community make the best partners because they're invested. They care. Sometimes this is not on their radar. They're like, hey, we didn't think about secondhand smoke exposure, right? And so sometimes it takes a minute to get them there. But man, they will fight tooth and nail to defend the community. And if they believe in this issue, then this becomes a priority. So all that to say, sometimes it's about an assessment about what groups get stuff done, like who's had success in the community passing a policy either similar to this or something that may have been a little edgy or just really required this type of organizing and advocacy, and making sure that that group kind of aligns with your issue. And not directly, but indirectly. They wouldn't be in opposition to what you're trying to do. And we found that those groups, man, they get it. Even when they don't know it sometimes, but they care about their community and they will do anything to fight for it. And sometimes they need some help with resources because they're not already funded to do that, but that's where the other partners come in, and we all try to work collectively, either with direct or indirect resources to help local campaigns wherever we can. So yeah, if you're not the group to lead such, sometimes there are others, and it just takes a little bit of an assessment to figure that out and some conversations, because you'll be surprised who might step up.
Thank you. And then we have a question in the Q&A. Do you run into confusion on which products are covered by using language smoke-free versus tobacco-free? I know you can define in the policy, but in terms of broad messaging.
Not necessarily. And I think because these campaigns really our messaging, our smoke-free messaging is also so closely aligned with secondhand smoke exposure that from that standpoint, it's clear that it's about things that are being smoked. I think where some confusion comes is about which of the smoked things this applies to. And if it's just commercial and combustible cigarettes, or that we're also talking about electronic cigarettes and vape products or hookah, and it's getting into these other things that are clearly smoked. And so the definition, we have some pretty well-defined terms within the policy language defining what smoking is, and what I don't think it defines tobacco products. I can't remember if the term's tobacco products or something else, but we're pretty clear, and we list out some stuff to make sure people understand what we're talking about. But I think in terms of general conversation, not so much, because we're talking about secondhand smoke exposure, and smoke-free applies to that.
And then a question in the chat, are there any ads that feature people who smoke supporting smoke-free casinos, for example, with messaging that they will go outside to smoke rather than expose workers to secondhand smoke indoors?
Great question. Great question. I know I don't know. And I imagine it's been brought up and said, actually, there is a survey, so it's not an ad campaign per se, but I don't know if you're familiar with the gaming sort of social media, but this guy, Brian Christopher, who does BC Slots, he's a gaming influencer, and he goes to all the casinos he live streams from his stuff. He's super, super popular. And he has committed to only going to smoke-free casinos now. But he did a survey of all of his Rudies, his network, right? And so he's got some good stuff talking about how they support and will only, whatever it is, right? And how popular this is, and people want smoke-free casinos. And I think as part of that, that gets addressed, but I don't think there's anything like the video stuff that shows casino gamers, patrons saying, hey, I'll be okay with going outside. But that's a great idea. And I think teasing that out too, because that's what the casinos care about. Like, they want to know if their people are okay with going outside. And we may need more of that. That's great. I will make notes. When you see it, you circle back around and be like, I told them to do that. But that's a great suggestion.
We have a few more minutes for questions. I'm going to go ahead and drop the link to the evaluation into the chat and pull up the QR code for the evaluation. So if anybody has any other questions, please feel free to drop them in. But one more question for you from us on Jewel is, what would you suggest for people who already have a smoke-free policy, but it does not include e-cigarettes? How would you suggest to them to approach addressing that loophole within their smoke-free policy?
Yeah, we've seen a lot of this lately, and this is one of those that you got to be really careful with, because so many communities now do want to address that and need to, and we have to be really careful about that, because as much as we want to add this into the policy to make sure that they're included now in smoke-free protections, we don't want to open up this opportunity for anything to weaken that ordinance when we start getting it addressed publicly. Like, now they want to pull out a different, type of category of establishments, but we're adding this in. I would have a conversation with, concerned groups, partners that would be involved in this process. Like, hey, should we take this on? And I think there's a conversation that needs to happen with, let's say, like the decision-making body, like the city. Like, can we do this in a way and make sure that we're only going to touch this if we can strengthen it, and not opening up this opportunity to weaken this policy by any means? But I would start with the conversation with partners, and if that's, your public health partners and health department, and then figuring out who best to approach at the decision-making level to see if there's interest and if this can be done in a way that still protects whatever strong protections you already have.
Thank you, Jewel. And so as we conclude, I just want to thank you again for coming and leading this wonderful webinar. And thank you to everyone who attended today. We kindly ask that you fill out the evaluation either by the link or the QR code. And please note that letters of attendance are only given upon completion of the evaluation. So thank you again for joining us, and we hope to you have a wonderful rest of your day.
Thanks, everyone. Thanks, Abigail.